to Barry University, to the Brinkley studio in the telecommunications department. I'm Sister Marie Carol Hurley, and the name of this program is Conversations. Today I'm having a conversation with Dr. Victoria Schoolcraft. Welcome, Victoria. I'm going to call you Vicki.
That's fine.
It'll be easier, all right. But this is Dr. Victoria Schoolcraft from the Barry University School of Nursing, which is one of my favorite schools at the university. And so I really am happy that you're here. We were talking a little bit about the growth of the School of Nursing. It's pretty booming this year, you say.
Yes, nursing's really popular right now, and all of our programs are really growing. A lot of young people are coming into it, as well as people who are looking for a second career.
Well, that's really good. But before we talk about that, I'd like to ask you a couple questions about yourself. First of all, where were you educated?
I got my bachelor's degree in nursing at the University of Oklahoma, my master's degree at the University of Texas. Then I went back to the University of Oklahoma to teach, and that's where I got my doctorate.
At the University of Oklahoma.
Right.
I've only seen their football teams, never their campus.
Well, there's a lot more there, but that's what most people know.
They know the football team.
Yeah.
So sort of like University of Miami.
Right, right.
But there are a lot of other things at both universities.
That's for sure.
Yeah. Well, Victoria, when you decided to come to Barry, was it to come to live in Miami or to come particularly to Barry University?
To come specifically to Barry. That I found out about the position that was available, and I came here and I just fell in love with the people. And I did want to move someplace that was warmer in the winter than Oklahoma. That was part of my motive.
Sure.
But I really liked Barry in comparison to some of the other places I looked, and I've never regretted that decision.
Good. Oh, I'm certainly glad. And how long have you been at Barry?
This is the beginning of my 6th year.
6th year. I thought it was about that, yes. Well, what specialties, what do you teach right now?
Well, my expertise is in psychiatric mental health nursing in terms of my clinical. And I have a variety of other interests. I like to teach about teaching as well. I do some graduate teaching with people that are majoring in nursing education.
Oh, those are interesting fields. Psychiatric nursing, right now there's such an interest in that because of here, the hurricane, they're afraid will leave people with lots of problems.
Right.
So,
Yeah, I've been working with a couple of different groups on helping people with post-traumatic stress.
yes. Well, we've heard about that, but particularly caregivers like pastors in churches and all who themselves are burned out or who are wounded healers.
Right, right.
And they need some post-traumatic healing.
Right, that's for sure.
Well, that's a wonderful field to be in. And today I want to ask you if you'll talk about a personal story, and it has to do with surviving too. We're talking about surviving the hurricane, but that's cancer survival. And you yourself have a story about that. Could I ask you to tell that?
Well, almost exactly 4 years ago, I was diagnosed with ovarian cancer and had surgery to remove the tumor. And following that, I had chemotherapy. And since then, I've had 2 recurrences with surgery and chemotherapy after each one of those. And currently, I've been in remission for 10 months and hope to remain in remission. I think that when I was thinking about talking to you today about this, one aspect I was thinking of was related to the feeling I've had that I have been thriving as well as surviving. I look at survival as sort of the basic, the foundation. We all have to survive. And survival just means that you go on after something. But thriving, I think, is on a different level of doing more than just surviving, but growing and changing and becoming different in a better way. And it's been amazing to me to have that experience. It's made me look at my life differently and make different kinds of decisions about my life.
That's marvelous, because right now I see that thriving is what we want to do, and this growing and changing. Even after the hurricane, we just don't want Miami to survive and somehow get through it, as you say, just on this level, but to really be alive. So I can see that. Would you say a little bit about how this happens to a person that they not only survive, but they thrive.
Well, I think most people have the experience if they've had a near-death experience or possibly terminal illness of starting to re-examine what's important to them. And that's what happened with me as I started thinking about what do I really want out of life? How have I been living my life, and do I want to keep living it that way? If there's a possibility it could even be more limited than I would have expected, is there something that I can do to make the quality of it better for me? And I realized there were lots of things I was putting off. And I'd think about visiting a friend in Colorado, and I think, well, I'm so busy now, I'll try to do that next year. And I've completely quit doing that. And there's some of my friends that now I visit them at least once a year, and I visit my sister every year, and I do things to encourage people to come and visit me, which thankfully in Miami you've got some things to help you encourage them.
Yes.
So I've quit putting those things off, and that's really, I think, enriched the quality of my life.
I think that's an important point. I hope those who are watching us can relate to that, because we put off, it seems we never think of our own end. And then when we're face to face with it, we say, I want to do this thing I've always wanted to, why don't I do it? So that's wonderful. And visiting people, I just think it's so important.
Yes.
Touching base, huh? So that's one of the,
connected.
yeah.
Another thing has been my thinking about my own health. And even though I'm a nurse, I think I am typical of a lot of people that I think we tend to take health for granted, and we don't tend to think of it as something that we can work on to improve for ourselves. And since being diagnosed, I've done a lot of things to change my lifestyle to be healthier. And one of those has been losing a lot of weight, and I'm continuing to do that. I've started walking every day for 1.5 miles. I used to tell people I didn't decide not to exercise. I wouldn't even think about it in the first place.
No decision.
I just didn't do it. And now it's something that I want to do, and it makes me feel good.
Isn't it great? What time of day do you walk?
I do it in the evening when it's getting cooler.
I do mine in the morning between 7 and 7:30 before it gets warm. We can't walk a lot here, but oh, it's so nice.
Yes.
Yes.
Well, and I felt a difference in my life with that. And I thought a lot about relationships and opportunities, and there are different aspects of my life or myself that I think I had been just ignoring. And I've really started looking for opportunities to change in those ways. For one thing, I've always been sort of shy in social situations.
You probably wouldn't have come to have this conversation.
I wouldn't have volunteered to do this 4 or 5 years ago. And I've gotten more comfortable with that and going and trying to get to know people and trying to become less self-conscious and more other-conscious. And lately I've met some really interesting people by not worrying so much about that, because I thought it would be a shame to leave this material life and give up those opportunities to get to know as many people as I could while I'm here.
That's a really important thing, this thing of relationships and deepening them. That makes you more alive in any one day, doesn't it? Yes. So that's just another very valuable point in this.
I think another thing that I've thought a lot about has been my spiritual values. And that I think that believing in God and trusting that God was always with me has helped me get through this experience. I don't know how I could have coped with it if I didn't have a strong faith. And there were lots of times when I was recovering from surgery or going through chemotherapy that I couldn't concentrate on anything, and I felt miserable, and all I could do was pray, and that was very comforting.
Oh, yes.
And it's really strengthened my faith. I think sometimes when bad things happen to people, they might feel that God's abandoning them, and I feel that God put all this in motion, this material universe, and but he's here to help us deal with it.
Yes.
And I've felt that strength very much, and that's meant a lot to me. That's another way I think my faith has thrived, the spiritual aspects of
Yes.
myself.
Sounds a little trite, maybe people would say, oh, God got me through or something, but I don't think we think about it that way, but that he's there for us to get ourselves through, kind of, and there, strengthening us. As you say, he put it in motion, but we see it through, and he's there. He's there for us. I know I've often thought that. How do people endure tragedies without that help from God and prayer? You know, I think sometimes we have a wrong concept of prayer. That you say, I prayed and I still got cancer, but the idea is that the prayer helped you through. You know, prayer helps me anyway.
Yeah.
I'm
Well,
glad it helped you.
I still pray. Every day I pray that I won't get cancer again, because that's still a possibility.
Sure.
And I also give thanks that I've survived to this point and that I've gained so much from the experience. And I feel really good about myself that I was able to deal with this experience in this way. From the very first, the night of the day that I got my diagnosis, when I was talking to my friend and telling her about it, she was the first one I talked to, I said, I want to fight this disease, but I am not going to fight the experience. And I think that's helped me all the way through it, of letting myself just have the experience, live with it, and battle the cancer, do everything I can to get rid of the cancer, but not to fight the aspects that go along with it, which that's sometimes difficult when you're facing having to get chemotherapy for the third time or something like that.
Oh, I know.
But each time I was able to do that, and I'm glad that I was.
That's really a wise way of looking at it, to fight the disease, but not to fight the experience. I haven't heard it expressed that way before, but I think that's really an insight, a really wise thing. I'm glad to hear you say it. It's something I'm going to think about too, you know? I hope everybody will. So, and that's another thing. The chemotherapy, though, was that the hardest thing?
Well, the very hardest thing was after the first two surgeries, I had to be on a ventilator for almost 24 hours while I was conscious. And that is, it's physically unpleasant to have that tube down your throat, and to feel dependent on a machine to keep you breathing. But I was completely conscious and aware. I understood everything that was going on. One thing that was interesting was that a lot of people responded to me as if I wasn't alert or aware, since I couldn't talk. And people would come in and start doing things to me without introducing themselves or explaining what they were doing. And if I responded in some way, they'd react as if I was out of control, because they're more familiar with dealing with people on respirators that are not conscious and alert. And it was frustrating to try to communicate and to be treated like I was just an extension of the machine rather than that the machine was helping me. It was awful. And the most relief I felt was each time when they extubated me and I was able to breathe on my own. And the third time I had surgery, I didn't have to be on a ventilator because they used a different kind of anesthesia. And I was awake and alert in the recovery room. I felt like I was ready to walk to the ICU. I felt so free being able to breathe and not have that machine on me. But the chemo wasn't pleasant, especially the first time, and it got better each time actually, because the kind of medications that were available are always changing and getting better. One part of being on chemo that was unpleasant was the drugs you have to take along with it to try to control the side effects of the chemo. And the antiemetics that keep you from being nauseated make you feel drowsy and flaky. And I never could really sleep. That was what was awful. I always felt like I wanted to be sleeping, but I couldn't sleep, and was not able to concentrate. I couldn't enjoy television. I couldn't read. It was just unpleasant. And then after I'd get off them, I'd have a rebound effect, and I'd be hyper for 2 or 3 days and couldn't sleep at all. And that was bad. But the last time I had chemotherapy, I was able to have it. It was limited to 1 day, and I had it at home.
Oh.
And the nurse came to my house and gave me the chemotherapy, and by that time they had a different kind of antiemetic which didn't have any side effects of its own. So it was very simple. I could have this done in my own bedroom with my kitty cats keeping me company. And the chemo ran in over about an hour and a half, and then the nurse gave me some the antiemetic a couple of times during the rest of the day, and then that was it. And so it was a little disruptive because of having to be out of work 1 day every 3 weeks, but just like a world of difference from the other times.
In the meantime, you were back at school and back at your teaching, and you're having this at home.
Right.
Oh, that's...
All 3 times, as soon as I recovered physically from the surgery, which was about 5 or 6 weeks, I came back to work. And one of the big issues in dealing with all this is a feeling of a loss of control. And one thing that was important to me that I think is probably important to most people is having things that you feel you can control. And for me, I felt in control by being able to come to work and do ordinary things. That for a while there would be times where I was going to the doctor and taking medicine and dependent on people for almost everything.
No control of that.
And it was gratifying to get to the point where I could control my own life again.
Vicki, this treatment, when you were on the ventilator, people coming in and treating you in that impersonal manner, has that influenced the way you instruct your nurses?
Yes. I have had the opportunity ever since then, almost every year, to talk to our nursing students about my experience. And the way that I present it to them is very much from the aspect of trying to help them understand my experience and relate it to situations they might be involved in, and helping them to understand what that patient might be feeling like. I think sometimes their patients don't ever have the opportunity to say, this is how I felt when that happened, even though I couldn't tell you. I also have done a presentation for some groups of other kinds of health caregivers that work with oncology patients, including some respiratory technicians, to talk to them about that and help them understand what it feels like. And I think sometimes when people hear a person telling them, this is what I went through, this isn't what I studied about or did research about, this was my experience, this was my feeling, it has a bigger impact on them. And I think that's another thing that's been gratifying to me, is that I feel like I've gained something that I have to offer now to use in my teaching, to help do the same thing that I've wanted to do for years, which is to help my students be the best nurses that they can become.
It's remarkable. That was a really side benefit of all this, to make you a better teacher. And it was like that film, the Doctor, when he has the experience of being treated as a patient and realizes how a patient feels. And you were able to experience that. And no. You know, when you were saying you were on the respirator and couldn't talk, so they thought you were not conscious, do you think that this happens a lot of times? People are really conscious, but because they can't speak, they're treated as inanimate objects?
I'm sure that it does.
Yeah.
And there was a lot of variation, because not everybody treated me that way.
No, of
and
course.
There was one of the respiratory technicians that was with me the first night after I had the first surgery. Every time he came into the room, he spoke to me and he used my name. He would say just conversational things to me, and if he'd ask me a question, it'd be something that I could shake my head or nod. And I was having a problem because of something to do with the equipment, and every time I rolled on one side, I was aspirating fluid that was condensing in the tubing. And as soon as he realized that, he was just right on it, trying to figure out what was wrong to make me more comfortable. And the person who'd been on duty before him had noticed that was happening, but all he did was to tell them not to put me on my right side. And then in the next morning, the 3 doctors that were taking care of me all thought I should stay on the ventilator another day. And I started shaking my head and banging on the side rail. And the technician convinced them that he thought I was ready to be weaned. And he talked to them a long time, and then he came in and started doing the things he needed to do to get me off the ventilator. And he was really my advocate in that, and I really appreciated that. And there were some of the nurses that they understood that I was really completely conscious and cognitive. And they, if something would happen with someone else, they didn't act suspicious, like maybe I was starting to lose it or something. The ICU psychosis that people sometimes get because of the confusion and disorientation in ICU takes a while to set in. It doesn't happen within the first 24 hours. That would be very unusual. And people don't go from being completely conscious and aware to suddenly being psychotic. And the competent people around me understood that, but the less competent people who were really just technically oriented didn't understand that.
And you've had opportunity to talk to a lot of groups then about this, have you?
Yes.
Oh, that's really good. Because I've often thought that, and my experience is keep on talking to somebody as long as they're alive at all, they haven't been declared dead. And with a couple of my friends that we used to like to sing together, to sing with them, and I could tell they were reacting when we were singing. You know, they couldn't sing themselves, but they were singing inside. And I think we have to be so aware of this, the patient as person, all the while, and never as thing. It's really hard. So, but you know, the technicians, did they get this special kind of training, or was he just an unusual young man, do you think?
I have a hunch that it was because of the person he was, because a lot of people that are technicians, not to minimize what they're doing, but they're focusing on doing a certain skill, and they don't have a wide range of knowledge in terms of understanding the whole person. And in most nurses are not technicians, and they learn not only how to do the skills, but also to understand the person and to be able to be supportive and look at more things than just the machinery, for example.
I just think it's such a wonderful example you're giving me and telling us about this idea that something that seems terrible could really be a benefit, could be something good for you and for us. And I liked it right from the beginning when you said not survival but thriving. And also able to give more because of all these experiences. I suppose people don't pay much attention if they themselves think they're never going to get sick or never, especially young people. Have you been able to really make people conscious of preparing for survival?
Well, that's one thing I've talked to the younger nursing students about, because they're still so young that it's hard for them to think of ever getting that sick or of eventually dying. And that I know your perception of that changes, your vulnerability, your sense of vulnerability changes as you get older. And I think for most young people it's still more an intellectual understanding than having empathy about it. But I hope that some of the things that I've said, even to fairly young students, will have meaning when they need to work with someone who has a problem.
Even what you've said has had a lot of meaning for me, and I have been really instructed by the clarity with which you're able to express these things that have happened to you. When we're talking about this survival from the hurricane and that experience, do you think that there will be constantly things setting in, that effects of the hurricane that we don't know now? for the people who survived it.
Yes, that's one of the difficult things about the syndrome that's called post-traumatic stress syndrome, that people are so busy trying to survive, which is just taking care of those basic needs, that they don't have time to think about what they're feeling. Or else they're afraid they might get overwhelmed, and as a matter of fact, they might, and they might not be able to do the things they have to do. And so they keep putting off dealing with it. And then they do that for so long, when they have the opportunity to talk about it, they're not able to. And they need support to do that. So the kinds of groups that people are offering that are available are helpful in terms of acknowledging this is something that you do need to talk about, and it'll help you to talk about it. And the best approach to that is to encourage people to tell their story.
Yes.
And to just let them tell what they did during the hurricane, how they felt, what they thought was going to happen, what they feel now about what they did. Sometimes people are ashamed of what they did to survive, or they're ashamed about something that happened during it, and they need to have someone listen to them and give them permission to just describe it. And then once they describe it, sometimes once they describe it once, they have to keep talking about it. And then eventually they start connecting with the feelings that go along with those experiences, so that they can start healing. Again, it's loss of control that's the most significant issue.
Sure.
And they need a sense of getting control back on their lives.
Vicki, were you always a pretty religious person, or has this made you more deeply religious?
I was not always a very religious person. As a matter of fact, most of the first part of my adulthood, I didn't really believe in God, even though I had gone to Sunday school and church and so forth. But I didn't really believe there was a God. And then about 12 years ago, I started studying more about it, and I had a variety of experiences and started believing that there was a God. And then over the years, that's been reinforced for me. And this experience has made it, I think, even more intense. It helps me because I believe that there is a life after this life, and that this is a prelude to that. And as I think I said earlier, I think this life is important. It's important for us to have the kinds of experiences we have here, but we're going to have other kinds of experiences and keep evolving as we get closer and closer to God.
That's wonderful. I'm so glad that you came today and that you're saying all these beautiful things. And I hope that everyone who has been listening to us has heard deeply inside them what you're saying. I know they'd like to ask you a lot of questions, but just if they can remember the tremendously important points that you made about this more than survival, this thriving and growing. And I hope that it'll happen to help a lot of people. I thank you very much for coming. And our time is up already. It went so fast because it was so interesting to hear about it, and very touching to me. I thank you very much. And thank you all for joining us. And I hope that you join us again next week, when we will have another conversation, and maybe we'll invite Dr. Schoolcraft to come back again sometime. And if you have some questions that you'd like her to answer, you would let us know here at Barry University. So from the David Brinkley studio of Barry University, this is Sister Marie Carol Hurley, and this is Conversations. And thank you for joining us.